Equity Bank, which is the largest bank by account holders, set up a digital center 2 years ago to enable it to run its systems and manage its expansive pool of customers. The center, which is the nerve center of Equity's operations, currently has excess capacity beyond the requirements of the entire banking sector. Equity is already holding talks with the international ICT company IBM to outsource and lease out additional capacity.
We are hoping it will reduce our cost because essentially we would be sharing the cost and we would take 8% of the cost and others would take 98%. At the moment we are bearing 100%. So the reduction in cost would be very, very significant.
The bank has already leveraged on its data capacity to roll out its agency model to over 8,000 agents across the country. This will help deepen financial access for a huge proportion of the unbanked rural Kenyans who had previously been locked out due to expensive costs, which include long-distance travel to access financial services.
What we have seen is that people who had had their accounts falling dormant simply because of the cost of reaching the bank are now reactivating the banks. So far, 46% of all our dormant accounts have been reactivated.
Mwangi was speaking at the third annual Connected Kenya ICT conference being held in Diani, Mombasa. Mobile telecommunications company Safaricom, in partnership with international ICT firm Cisco Systems, also unveiled test trials for a new virtual health system that will leverage on digital villages to ease access to medical services by Kenyans. The system will enable Kenyans in rural areas to consult doctors via video conferencing over the internet. The two companies hope to tap into the existing community health workers to provide clinical health services. Githaiga, Citizen Business in Mombasa.